for joining today's webinar, using Cdbg-CV for public facilities. My name is Rob Srantz, and I'm with the Cloudburst Group. I am joined today by Sarah Daines, subject matter expert with the Cloudburst Group. Hi, Sarah.
Hi, Rob. How are you?
Great. And Stephanie Jennings of Abode Community Consulting. Hi, Stephanie.
Good morning, Rob. Good morning, everyone.
Yeah, morning. And we're also joined by Chelsea Jones and Gloria Coates from the Office of Block Grant Assistance. Good morning to both of you.
Good morning.
Good morning. For the next hour, our presenters will discuss how grantees can use CDBG-CV funds for public facilities activities. We'll hope to have time for questions at the end of the session. As Emma noted, please submit questions as you have them in the Q&A pod. I will be logging them as we go along, and we will get to as many as we can. Also remember that we do have HUD Ask a Question for Cdbg-CV. So if you do have lingering questions and you don't get them answered, please take advantage of HUD Ask a Question. Please use the chat if you need help with Zoom, and remember the Q&A for questions. And with that, I will turn it over to Sarah.
Thank you, Rob. Good morning, everyone, and thank you for joining us. So let's get started. The adoption of the CARES Act following the declaration of a national public health emergency in early 2020 resulted in the allocation of roughly $5 billion in additional funds to CDBG grantees to assist in the preparation, prevention, and response to the coronavirus. Unprecedented numbers of people were faced with the possibility of losing their lives, their housing, their jobs. Schools were closed and students were unable to attend classes. Stay-at-home orders were issued and businesses were closed. Public transit systems reduced services, creating challenges for those deemed to be essential employees, and increasing numbers of families faced food insecurity due to a loss of income. Low and moderate income individuals and communities of color were, and continue to be, disproportionately impacted. The initial focus of grantees this past year and a half has been on addressing the immediate and urgent needs of members of their communities. Emergency subsistence payments were provided, food pantries ramped up their offerings, and financial resources were provided to local businesses, nonprofits, and medical providers directly and indirectly impacted by the coronavirus. The importance of these efforts cannot be understated, and as evidenced by growing concerns regarding the spread of coronavirus variants, remains important. Today, as communities gradually adapt to a new normal, HUD, as noted in the Cdbg-CV toolkit, is encouraging grantees to consider using CARES Act funds to address the longer-term impacts of the coronavirus. The development of public facilities and infrastructure improvements, the focus of this session, is one way that grantees can foster more resilient communities, not only to address the challenges presented by the current pandemic, but other ongoing sustainability crises. Today's session is designed to provide participants with the resources needed to think strategically and creatively when investing in public facilities, which address the impacts of the coronavirus, in addition to the public service activities that have been their primary focus up to this point. With the careful use of your Cdbg-CV funds, public facility and infrastructure improvements can be developed to address community vulnerabilities that have become increasingly apparent since the declaration of the national public health emergency. A well-planned and designed public facility activity can further your community's efforts to address the social and economic impacts of the coronavirus, improve access to social services and healthcare, expand non-congregate shelter options, create safe and reliable learning settings, enhance outdoor recreational opportunities, and create safe, viable, and vibrant neighborhoods. During today's sessions, we will cover the basic program requirements that relate to public facility projects, offer examples of eligible activities, provide an overview of factors to consider in the development of your project, and identify other CDBG and federal requirements that may apply. The session is patterned after the Public Facilities Quick Guide published by HUD earlier this spring. If you haven't had a chance to look it over, we encourage you to do that after the conference. Throughout the presentation, we have included links to a number of HUD resources in addition to the Public Facilities Quick Guide that we believe will help you evaluate and develop your project. Specific references to CFR citations are included in these guides. We encourage you to explore them. There will, as Rob mentioned, also be an opportunity to ask questions at the end of this session. With that, I'm going to turn it over to Stephanie Jennings. Stephanie?
Good morning, everyone. I'm happy to be here today to talk about Cdbg-CV public facility projects. First, what are public facilities? Within the CDBG program, this term refers to a really broad range of facilities that primarily provide services and benefits to low and moderate income people. In general, these facilities are owned by public or nonprofit entities and can include social service facilities, shelter and day access centers, childcare centers, public infrastructure such as sidewalks, outdoor facilities, and also accessibility improvements. Today, we're specifically talking about how to use Cdbg-CV funds to support public facilities. It's important to start with the major parameters for use of CDBG funds, which means you must expend the resource on an eligible use of funds, tie the project back to coronavirus, and use the funding to support a project that meets a CDBG national objective. Thankfully, there are a number of different projects that can meet all of these required elements. Also, there's no cap or limitation on the portion of your CDBG or Cdbg-CV grant that can be used for public facility projects. Lastly, these projects can be carried out by a grantee, subrecipient, or other nonprofit organization. In general, eligible public facility costs relate to permanent physical improvements in structures and public areas. Funds can be used to support acquisition of improved and unimproved property, new construction or reconstruction, rehabilitation and adaptive reuse, as well as installation of public improvements. I should also mention that related costs such as engineering and design costs can be part of a public facility project. Funds cannot be used for maintenance or movable equipment. In general, CDBG and Cdbg-CV funds cannot be used to improve buildings for the general conduct of government. There are a couple of exceptions that we'll mention later. While operating costs cannot be funded as part of a public facility project, they can potentially qualify for funding as a separate CDBG or Cdbg-CV public service activity. For additional information, please refer to the Guide on National Objectives and Eligible Activities for CDBG Entitlement Communities. Next slide. So let's talk a little bit about the coronavirus tieback requirements. Grantees must also establish a specific tieback relationship to preparing for, preventing, or responding to the coronavirus. HUD guidance allows projects that directly reduce the spread of coronavirus or respond to its impacts, projects that also address indirect impacts such as economic and housing market disruptions caused by the coronavirus, or will mitigate future coronavirus impacts. The PPR Tieback Flexibilities Quick Guide is a good resource for examples of projects and how they relate to the PPR requirements. It's also very important for you to document the PPR tieback in your files. The tieback to how Cdbg-CV funds have been used to prepare for, prevent, or respond to the coronavirus must be part of your project eligibility analysis and be clearly documented in your project records. Now we're going to spend a little bit of time talking about national objectives and how they relate to public facility projects. This is the third major requirement, and a project must meet a CDBG national objective by providing a benefit to low and moderate income people, preventing or eliminating slums and blight, or addressing an urgent need in response to a disaster. At least 70% of a grantee's total CDBG-CV allocation must be used to benefit low and moderate income people. There are 4 benefit categories that can be used to meet the low and moderate income national objective, which include low mod area benefit, low mod limited clientele, low mod housing, or low mod jobs. Given the nature of public facility projects, low mod area benefit and low mod limited clientele are frequently used paths to meet the CDBG national objective. I'd like to take a moment to talk about each of these paths a little bit more. For low mod area benefit, you'll need to establish a service area for the project and have data that shows that at least 51% of the households in the service area have low mod incomes. These areas must be primarily residential. For low mod clientele, there are several ways to document benefit. First, the project can benefit a specific group that's presumed to be eligible or have a low moderate income. These populations include abused children, battered spouses, elderly persons, severely disabled adults, homeless persons, illiterate adults, persons living with AIDS, and migrant farm workers. Second, you can collect data to show that 51% of the people served have low or moderate incomes. Third, due to the nature and location of the improvement, you can show it will benefit a specific group presumed to be eligible. Accessibility improvements are a good example, as the nature of these improvements allow you to assume the project will benefit people with disabilities. Each CDBG national objective requires different types of documentation that must be considered before moving forward with the project. You can find additional information in the guide to national objectives and eligible activities for CDBG entitlement communities. So let's talk a little bit about duplication of benefits. Duplication of benefits is an important requirement of the CDBG-CV program that should be considered as you think about both your CDBG-CV program and each specific project. Grantees must have file documentation that shows no duplication of benefit has occurred. At the program level, it's useful to think about what other resources are being used in your community to support the types of projects, public facility projects you'd like to support with CDBG-CV funds. At the project level, it's important to have a complete project budget with verified sources and uses to be able to show that there is no duplication. There's a website on the HUD Exchange with links to additional duplication of benefit resources that we've provided below. Let's transition to models of projects that can meet your local needs and are a good fit within the CDBG-CV program. In addition to the model projects shown in today's presentation, you can find a table with more examples in the Public Facilities Quick Guide. So first, let's talk about emergency and short-term shelter facilities. There's an enormous nationwide need to expand emergency housing to prevent the spread of coronavirus among people living on the streets, in congregate shelters, or overcrowded housing. Examples of potential projects within this category could include acquiring a motel as a non-congregate shelter or for coronavirus recovery, retrofitting an existing shelter to increase social distancing or reduce coronavirus transmission, or even building an entirely new emergency shelter facility. As you can see at the bottom of the page, we've listed the potential eligible activities and then also the national objective, which is low moderate clientele. The CDBG, for low moderate clientele, homeless persons are presumed to be eligible. CDBG-CV investments in shelter facilities can be paired with other HUD resources such as ESG and continuum of care to expand both the physical and operational capacity of such facilities. Let's go on to the next slide. Social services and childcare facilities are another area where you can make public facility investments. During the pandemic, many social service and childcare facilities had to interrupt greatly needed services to reduce the spread of coronavirus. Many of these facilities need improvements to safely reopen for both beneficiaries and staff. CDBG-CV funds can be used to support a variety of physical improvements to these facilities that are owned by public entities or nonprofits. Examples of improvements to existing facilities might include HVAC improvements, reconfiguration of interior spaces, expanding outdoor spaces, creating walk-up or drive-through windows. Communities can also use funds to create entirely new facilities in response to direct or indirect coronavirus impacts. There are multiple eligible uses of funds for social service and childcare facilities. Many facilities are providing services to populations that are presumed to have low moderate incomes, which allows you to meet the CDBG national objective. You can also collect beneficiary data to show that 51% of the persons served have qualifying income. It's important to note that public facility investments can be paired with public service activities to expand the facility's capacity to provide public services. I'm going to turn it back to Sarah, who's going to take us through some additional examples related to broader public improvements.
Thank you, Stephanie. Access to safe, fast, reliable, and affordable internet service is something that many of us take for granted. Unfortunately, according to the Federal Communications Commission, approximately 19 million Americans, over 6% of the country's population, lack access to fixed broadband services. A majority of these individuals live in rural areas where a quarter of the population do not have reliable internet service. Cdbg-CV funds can be used to help narrow this digital divide. The extension of high-speed internet access to underserved low and moderate income areas is an eligible public improvement that both prepares for and prevents the spread of coronavirus by providing access to students that are attending school remotely, increasing access to healthcare and mental health services, and by allowing residents to continue to work. Depending on how your project is structured, it can be designed to meet the CDBG program's low and moderate income area national objective, or if focused on a specific group, such as seniors or people with disabilities, for example, a presumed low mod benefit. As noted in the Using Cdbg-CV to Support Broadband Access guidance issued by HUD, CARES funds can be used to acquire, construct, reconstruct, refurbish, or install distribution lines, underground new or existing distribution facilities, install wiring, fiber optic cables, and permanently affix equipment such as receivers. Funds can also be used to improve internet services located within a public facility or social service facility. Many grantees have used CARES funds to offset the cost of internet service for income-eligible households. While an eligible CDBG activity, the use of funds in this manner is considered a public service and not a public infrastructure improvement. If you're interested in learning more about how to improve internet access in your community, I'd encourage you to attend the breakout session immediately following us at 11:20. It focuses on the use of CARES Act funds for the development of broadband networks. CDBG-CV funds can also be used to create new publicly accessible open spaces or reconstruct existing spaces, such by expanding existing side walkways, developing new public plazas, or creating permanent closure and repurposing of streets to allow for a variety of outdoor activities. Designed to promote social or physical distancing by providing accessible and attractive options for interacting in public areas, they can further local efforts to slow the spread of the coronavirus through the installation of permanent barriers such as bollards, planters, retaining walls, or fencing, delineating pedestrian or activity areas, by constructing permanent seating or shelters, and by installing murals, decorative pavers, audio installations, or other functional art. We've seen communities use these spaces for vaccination and testing sites, as well as for the distribution of food and other personal supplies. In my neighborhood, these spaces have been used for a variety of pop-ups, activities such as informal outdoor courts and picnic areas, free yoga and Pilates classes, chess tournaments, and farmers markets. A pop-up activity I came across earlier this spring, which I thought was especially unique, was the use of a repurposed public space where the organizers had set up a course which was used to teach kids how to ride a bike. CDBG funds can be used to expand the plaza area shown here, but because of their temporary nature, funds could not be used to purchase and install the temporary canopy, lighting, and seating that you see located on the plaza. An eligible public improvement activity, projects are often constructed so as to meet the CDBG program's low and moderate income area benefit objective. In some cases, they could be funded under slum and blight. Physical modifications designed to improve access to buildings by individuals with disabilities can also be undertaken using your Cdbg-CV funds. Considered a presumed low and moderate benefit, the installation of automatic doors and access ramps, touchless water fountains, and the construction of accessible interior spaces such as bathrooms and activity areas can help reduce the transmission of coronavirus. If you recall earlier in the presentation, Stephanie noted that funds could not be used for improvements to buildings used for the general conduct of government. Accessibility improvements are the exception to that rule. The last example of eligible public facility and infrastructure projects we will highlight today is the use of Cdbg-CV funds to create new or expanded recreational spaces. Designed to allow for outdoor activity and encourage physical distancing, these types of projects are typically located in residential areas where more than half of the population are of low and moderate incomes. Similar in nature to projects developed in public rights-of-ways, these projects can include the development, expansion, or upgrading of neighborhood parks, the construction or improvement of multi-purpose trails, and the development of outdoor exercise or play areas. Communities, when developing these spaces, have incorporated a variety of features into their projects to provide safe physical or recreational options for their residents. These have included outdoor exercise areas like the one depicted here, fire pits, which if you're in the north is a good idea, and areas dedicated for activities such as skateboarding, bocce ball, or horseshoes. Before returning the presentation back to Stephanie, I would like to reinforce the importance of evaluating each of your projects for compliance with CDBG program regulations and the CARES Act. Remember, before committing funds for any of the projects we have described today, you must verify their eligibility, identify and document how they prepare for, prevent, or respond to the coronavirus, and determine whether they meet one of the national objectives of the CDBG program. With that, Stephanie, do you want to take it?
Yes, thanks, Sarah. So next we're going to go through some project selection considerations. There's a number of additional considerations to keep in mind as you select and scope your public facilities projects. These include your community needs, project costs and timing, operating capacity, and ongoing use of the facility. The Public Facilities Quick Guide offers some guiding questions to help grantees assess these important issues that will impact the success of your project. Let's take a moment to walk through some of these areas. As you're thinking about community need, what are the gaps in availability and accessibility of public facilities for low mod populations and areas? One thing you might want to think about is how you're delivering your public services activities and if those facilities could benefit from some kind of public facility improvements to increase the impact of your public service investments. Project cost is another area that is very important. Is the estimated cost of the project reasonable? How were these estimates created? For timing, will the project be completed in a timely way and meet the CDBG-CV expenditure requirements? How complicated is this project, and what are the factors that may impact that timeline? Project management and operating capacity. Who has the capacity to manage the acquisition or physical improvements? Also, is there operating capacity to provide the service once the physical improvements are completed? Sometimes it's also important to think about the ongoing use of the facility. What's the period of benefit that you're expecting for the project? And would it change over time depending upon different coronavirus factors? And then we talked a little bit previously about duplication of benefit, but again, this is an important project selection consideration. Please refer to the quick guide for some additional questions and ideas for the things you should be thinking about. Next slide, please. So we're going to talk a little bit about the major types of public facility activities. There are several types of major activities you can undertake. The frequently used activities include acquisition, new construction, and rehabilitation. If grantees are new to managing physical improvements, it may be helpful to start with simple physical improvements or acquisition projects that are less time and resource intensive. In many cases, grantees will be working with partners to complete the project. It's critical to both assess the capacity of the partner to undertake the project and also stay in touch throughout the process. Detailed plans and agreements are important tools to mitigate risks, ensure that there is a common understanding of roles and responsibilities, and provide ways to recover resources if needed. A great resource for understanding this process is a series of videos on HUD Exchange called How to Use CDBG for Public Facilities and Improvements. Next slide. So for the acquisition process, there are a number of basic steps that you should be thinking about as you are undertaking this type of activity. It's critical to start with a clear scope of the project and desired uses and outcomes, and to also think about property identification. In general, acquisition of real property needs to be both arm's length and voluntary transactions. By arm's length, I mean that, for example, a city cannot sell property to itself except under some very specific circumstances. And also, this needs to be, if you're buying a property from somebody else, it needs to be voluntary. As part of the early due diligence, grantees should assess property condition, financial feasibility, and the presence of any commercial or residential tenants. It's critical to think through environmental review requirements from the very beginning to avoid site limiting actions. Similarly, there are multiple critical acquisition and relocation issues that need to be assessed early in the project. These are a couple of areas where it can be difficult to fix missteps later. One valuable tool for grantees is to execute a non-binding option agreement to establish a period of due diligence, outline the acquisition process, and environmental review requirements. This is also an important tool for making sure the property owner that you're purchasing the property from does not take any site limiting actions and manages any tenants in accordance with relocation requirements. In order to proceed with the acquisition, you must have completed the environmental review and received the release of funds from HUD, and also follow the acquisition and relocation steps. Once you place the project into service, there may be additional beneficiary tracking necessary to meet your CDBG national objective. We can go on to the next slide. For new construction and rehabilitation projects, it's also critical to start with a clear scope of the project and desired use at the time of project selection. The intended use must be identified upfront in order to qualify the project for Cdbg-CV funds. Grantees should assess property condition, financial feasibility, and also the presence of any commercial or residential tenants in the case of rehabilitation or even new construction. It's critical to think through environmental review requirements from the very beginning to avoid site limiting actions. Similarly, there are relocation issues that you should also be thinking about early in the project. The planning and design phase is very important as you need a detailed scope of work for the environmental review and to develop accurate cost estimates. These scopes should be developed by licensed architects or other professionals depending on the type of improvement planned. In order to proceed with procurement and bidding, you must have completed the environmental review and received the release of funds. Grantees must follow HUD requirements for procurement and labor, as well as their own policies and procedures. Once construction is complete and the project is placed into service, there may be additional beneficiary tracking necessary to meet the CDBG national objective. And the Public Facility Quick Guides walks you through the major steps for these types of activities and highlights the important regulatory issues that you should be thinking about. So this slide lists the major regulatory requirements that you'll need to comply with as a part of your project. The Public Facility Quick Guide summarizes these requirements and provides links to critical resources to help you understand the compliance requirements. I will turn it back to Sarah now to take us through the final slides.
Sarah, are you there?
Sorry, guys. Okay. So as noted earlier, scattered throughout this presentation are links to a variety of CDBG and CARES Act materials developed by HUD. We've identified a couple of additional resources noted on this slide we think will be helpful. They include information on specific aspects of the CDBG program regulations and CARES Act waivers, and in some cases provide examples of eligible public facility projects in addition to those we've highlighted during the presentation. Another resource that is not included in the slides is the Guide for Review of CDBG-funded public facilities and improvements used by HUD staff and available online. It can be a great tool to use to evaluate the compliance of your project with CDBG program requirements. The information presented during this conference has covered a range of topics that will also be helpful going forward as you develop your projects. I believe they'll be posted within the week and that you should check them out as you proceed with your plans. We also encourage you to take advantage of the technical assistance available through the HUD Exchange, and of course, to work with your CPD rep to address any specific questions that may come up. The links to both the Cdbg-CV AAQ Help Desk and HUD's on-call technical assistance are provided here. Throughout our presentation, we have emphasized the importance of thinking strategically when using Cdbg-CV funds for public facility and infrastructure improvements. A carefully planned project can not only respond to the direct and indirect social and economic impacts of the coronavirus, but they can also help you leverage additional funds, improve the immediate and long-term uses of available community resources, and reduce your community's vulnerability to future public health emergencies. Now, before we open up for questions, we have a couple for you. Rob, I'm going to turn it over to you and we'll do the polling.
All right, great. And Emma, do we have the poll up? All right, poll number 1. What type of public facilities activity is of interest to you? And you can select multiple responses. All right, how are we doing on responses, Emma?
We have gotten 70% of people.
All right, let's go ahead and close the poll. All right, Yeah, most people want to do still emergency short-term shelter, social service facilities. Great. Thank you. That gives an idea of what grantees are going to want to do out there. Next poll, please. So what are the topics where additional resources would help you to move forward with your public facility projects? Again, this is a multiple choice. Okay, we can go ahead and close the poll. All right, tieback requirements. Yes, we hear that a lot on the AAQ. So I know we've got some guidance out there, and appreciate the questions that you submit that help us walk through the particulars. So please keep using the AAQ. Okay, we'll go to questions now, and thanks. You've got a lot of questions, and also thank you, Gloria. She's been jumping in and answering some questions live in the Q&A. Let's see, excuse me. I think one question for our presenters, and it's Gloria's answered it too, but I think it's really important if someone wants to weigh in on it. Maybe you want to weigh in on it, Gloria. The question of the requirement that a public facility be open to the general public. And what exactly does that mean, especially if you're doing a limited clientele activity where it is sort of by nature, I'm sorry, I shouldn't use those words, those have other regulatory connotations, but if it is in fact operated so it does not serve the general public.
Okay, this is Gloria. Can you hear me?
Yes.
Okay. I did type an answer to that in here.
Yes.
I wanted to point out though that facilities that are designed for use by a particular group, such as runaway teens or the homeless or any other specific group, they're considered facilities used by persons with special needs. So they don't have to be open to the general public the same way that you would have a park has to be open, or a recreation center, or a similar type of facility. A tutoring center, for example, has to be open to the general public. There is a way, I guess, for persons who need assistance to be referred. And I presume that they are, brought there and processed, whenever the need arises. And that could be after what we consider regular business hours. For example, if you have a drug treatment center, which probably doesn't relate to COVID, but if you had, let's say, someone who was leaving a hospital and going directly to such a facility, that could happen anytime. But generally, those type of facilities have to be made available by the grantee, or usually it's nonprofits that operate those facilities whenever the need arises to admit someone, if there's space, realizing that there are space constraints. Does that help?
Yes, thank you. Thank you so much. Let's see. Yeah, glad to have you on the call. So there are also some questions around the restriction for general conduct of government. So one in particular, and I think this can be generalized perhaps to answer this, is community Wi-Fi. What if that Wi-Fi extends through, or I guess would emanate from city buildings for the general conduct of government?
you can't install it for their use. If you're doing a public improvement such as broadband infrastructure installation, wires, cables, whatever you want, the infrastructure that you need, that's usually a public facility and improvement, and it's usually done in a neutral location. I've never heard of someone using CV or any type of funds to provide the Wi-Fi emanating from City Hall or whatever. I mean, some places in DC have what they call free Wi-Fi in general, but I'm pretty sure that that's not something that was assisted with our money. Generally, that's done in areas where there's a need, where there's a deficiency in Wi-Fi and broadband. And of course, that's usually an area of benefit activity. So it would have to meet that national objective.
Okay, thank you. Let's see. Would replacing outdated playground equipment in an outdoor park qualify? What about basketball courts or a splash park? All would be creating accessible outdoor spaces. So I guess the question really was, how would such a project, playground equipment or recreation facilities typically qualify in light of CDBG and especially Cdbg-CV and the tieback requirement?
With CV, you have to make sure that you're addressing coronavirus. So if you want to retrofit things so that there's more social distancing, and provides additional space for people to congregate where they won't be crowded. I mean, I'm not talking about, a huge space for a concert. I mean, you can space out things so that, people can use them, but they're less crowded, less congested, to avoid contracting the virus, but that has to be carefully documented. That's not easy to do.
Great, thank you. Let's see, got another one here. Thanks, lots of questions. Sorting through them all here. We won't be able to get to them all, but remember, both ask a question and also please take the time to work with your local CPD rep. Oh, here's a good one. Can acquisition be a standalone activity for public facilities, and how would that go about meeting a national objective? So just straight acquisition.
What are they going to do? It depends on the end use.
Correct, thank you.
What's the end use? Is it going to meet a national objective? Is it going to, if it's CV, is it going to address, is that use going to address coronavirus? Because if not, then they can't do it. And they have to be able to carefully document how anything used with CV addresses coronavirus, the PPR. So what are they going to do with the facility?
I might just offer an example. Many places are looking at acquiring motels as emergency shelter. That building is pretty much ready to go. You could do it as a simple acquisition project, as long as you are meeting the national objective through the intended use, which in this case would serve homeless people.
Well, yes. But when I think of acquisition in general, it's like, I don't know what you're acquiring or why. That's why I always ask for additional information whenever necessary.
Yes,
Exactly.
That's something that we can do and ask a question. Stephanie and Sarah both know.
Oh,
You have the opportunity to get on the phone with you and talk it through. Here's one that's I've had several questions like this. Can Cdbg-CV be used to install sidewalks, make neighborhood improvements? in an eligible area to create safe, walkable neighborhoods. And I guess the question really there is again about tieback.
Yeah, that kind of thing is hard to tie back to coronavirus. You know, of course, in the notice, we said that HUD's not prohibiting grantees from carrying out any eligible activity identified in the regulations and statute, as long as the grantee is able to clearly provide the tieback. And in some instances, it will be very difficult. I mean, with sidewalks, are they widening them so that more people can walk on them without actually coming into too close proximity to one another?
Okay. Mm-hmm.
I mean, they have to look at the project carefully. I mean, some things we have to admit would be just better served with regular CDBG versus CV.
Great, thank you.
Well, and if I might add, I mean, one of the key elements of undertaking a public facility or infrastructure project is to be sure to go through the 3 steps that we identified during the session in terms of eligibility and, as Gloria has touched on, the tie back to the coronavirus, as well as national objective. So none of these projects are straightforward, but they are possible if you do your research and you design them appropriately to address not only the social distancing aspects of it, but other features that help prevent the spread of coronavirus.
Hey, thanks, Sarah. Here's one that I think it brings up a good topic or a good concern, something to watch out for. It's asking, can Cdbgcv be used to construct a separate office space for workers, so those providing the services at an emergency shelter facility? The office would be a separate building on the same site as the shelter facility and would be occupied by a nonprofit organization. And I said providing services, but presumably this could also be office space used for administration or other sort of overhead operations of the organization. So I know that can be a concern about.
The admin space, no, but the space for serving the public, yes.
Right, and how do grantees kind of walk through deciding which is which?
They have to use the guidance in 570-200B regarding facilities with eligible and ineligible uses. So they have to be able to clearly show the percentage of the facility that will be used as a public facility versus the admin. And just to make it easy, let's say they split it down the middle. That means that only half of the cost can be paid with CDBG, because only half of the space will be used for an eligible activity that meets the national objective. And they'll have to use another funding source to pay for the office space.
Gloria, I have a question for you related to that. This is Sarah. So if a grantee were to take an existing facility and needed to reconfigure the space to address the social distancing, to meet the social distancing recommendations that the CDC had issued, and that required the expansion of the existing building, a portion of which were to be used by for administrative purposes, how would you treat that?
For a nonprofit or for the grantee?
For a nonprofit, for example. So rather than creating or building a whole new facility, expanding an existing facility to not only increase the capacity of the building for services that they're providing, but also to allow for space for administrative staff that are providing direct services.
Any space where a public service is being provided to the public is an eligible space. So that's fine. What's not fine is the nonprofit director's office, because there are no services being carried out there. We're not responsible for making sure that their admin offices are okay. What we're interested in is making sure that social distancing and other requirements are, excuse me, let me drink some water, are met with regard to serving the public.
Okay, I just wanted to make sure that that distinction was clear to everyone that's listening. Thank you.
Oh, you're welcome.
Great. Thanks, Sarah. I think we have a few more minutes here, correct? Lots of great questions. So yes, one is how could CDBGC funds be used to upgrade sewer or wastewater systems? With more people working from home, it seems like this might be an option.
We've told people in the past that that isn't one, but I'm not going to sit here and say it isn't. If they can document the need and how it's tied to coronavirus, we're not going to say no. But if they cannot clearly tie that back to prepare, prevent, or respond to coronavirus, then that will be an issue.
Just to again expand a little bit on that, if participants want to look at the quick guide that was issued by HUD for the tieback, I believe included in the example is projects that allow for an expansion of existing infrastructure, water, sewer. But again, it all ties back, or it all, no pun intended, it all ties back to the tieback as far as how you can document that it will have a, will respond to the CARES Act requirements.
Yeah, I'm gonna go. Matter of fact,
Yeah.
I'm
So
gonna go to that, and
I believe it's included as an example of a particular project that could be undertaken.
very well may be, but of course it's going to have caveats. So
Oh yeah.
let me.
All of these things have caveats, right?
Of course they do. Yes, you're correct. But I just want to make sure, because I'm pulling that up now to make sure that what I'm telling you is okay. Like I said, in the past, before this guidance was released, that's what we were telling people. And I guess they had to come up with ways to make it easier for grantees to expend their CV funds within 3 years. So they had to come up with other ideas and ways for people to be able to spend their money.
Uh-huh.
Yes, as listeners, participants will tell, many of these, the devil is in the details. So please do submit and ask a question, and we can kind of help you walk through that, as Gloria is doing here, kind of walk through the regulations with you and walk through the notice and the published guidance. Then also, of course, work closely with your field office, because remember, in the end, it's going to be your HUD CPD representative that's going to come in after the fact and monitor. And if that person is not familiar with what you've done, it will make that monitoring process more challenging for both yourself and for your CPD rep. And often a lot of these very specific what ifs can be talked through with them, and they may have some knowledge on other projects and how they've worked. And as Gloria is mentioning, it's document.
Yes,
Document
yes.
your tieback, document your eligibility, your national objective, document your conversations with your CPD rep. They are the ones who are going to make the ultimate determination. We can help guide you, including headquarters. We can help guide you, but in the end, you're going to make sure that you've had that conversation with your local rep to make sure that they're okay with it, and they are really the only one that can say yes or no on reviewing after reviewing your documentation and your reasoning. Yes, this works. No, this doesn't. We can help walk you through it, but we cannot and we won't at risk of peril tell you, yes, this is eligible. Yes, this meets a national objective. What we'll do is say, well, let's look at the regulations, look at the guidance. Does it fit? So got a few
Yes,
more
thank
minutes
you.
here.
Yeah, I was going to say, excuse me for a
Yep,
second.
no, please.
Again, I'm looking at the language in the guidance with regard to public improvements, and it says that you can construct a public improvement such as extending broadband infrastructure in an underserved area. And this is what I think it was Sarah was talking about, reconstructing degraded water lines to support teleschool, and telemedicine, and to ensure potable water to homes, schools, and health providers. So that's the documentation that will be needed if they choose to do something like that, to repair or reconstruct degraded water lines and similar type of improvements. They have to be able to show how it supports. Here it says, virtual school, virtual medicine. Those are two examples, and to ensure water, potable water to home, schools, and health providers. That's what they'll have to do if they're doing those type of public improvements.
Thank you. There's a couple questions around sort of disease prevention, making things touchless. And I think there's sort of some general conversation we could have around that. But then one is constructing new public restrooms or hand washing stations with touchless features. How might that be eligible? And I guess more importantly, how would this one establish the tieback?
For something like that, you have to show that you'll have to be able to demonstrate that providing this type of facility will prevent coronavirus, because you don't have to touch anything. I'm not a scientist or an expert, but I've been reading in various places that touching surfaces has been shown to be a non-factor with regard to the spread of the virus. But that would tell me, no, you can't do it. But you have to do your research and make sure that wherever you are, because there are different laws in different states, and that there's nothing in effect that says, well, you can't do anything like that, because we have a study that shows that just touching things will not give you the virus. I know that sounded complicated, and I'm sorry.
Nope. It is complicated. So
Yeah. Well, and if I could expand on that just briefly, is one of the important things, a resource to have, is to go back to the CDC, because they have specific recommendations, as specific as they will get on occasion, for how to address the the health aspects associated with the coronavirus. And admittedly, they have evolved over time, but it is a good resource in terms of evaluating from a public health perspective how your project will prevent the spread of coronavirus.
Thank you
Yeah,
for that.
I was just going to add to another way to think about accessibility is oftentimes buildings only have one accessible entrance. But if you are trying to keep people separate and reduce the number of people that are intermingling in indoor spaces, you may need to add additional accessible entrances to a building to facilitate that access. You know, so that's a place where you could make a connection to the exposure and number of people that are in any given space and how to create separation in those spaces to reduce airborne exposure to coronavirus.
Great, thank you, Stephanie. And we are out of time. We're actually 1 minute over. Thank you, Sarah and Stephanie, for putting this together and presenting. Thanks so much for Gloria for fielding these questions. I know it's really, grantees really appreciate it when they get to speak to someone who from headquarters who is steeped in the regulations. Reminder, please take advantage of the many resources on the HUD Exchange, including the Cdbg-CV toolkit, which is a great way that resources published and in progress are going to be made available. So you can see what's coming a little bit there. There's some featured coming soon. And if your question was not answered, please submit it to the Cdbgcv Ask a Question. And also take note of other Ask a Questions that are available for system specific like IDIS and Econ Planning Suite, Heroes. Also there's ESG and HOPWA Ask a Question pools available too to help you out. This webinar has been recorded and will be available in 3 to 5 days on the conference site. Have a good day, everyone. Keep up the good work and please be well.